Welcome back to the audio guide from Pennsylvania Medical Marijuana Cards. Today, we are unpacking one of the broadest and most clinically important qualifying conditions in the entire PA state program. But here's the catch. Most patients who qualify for it have no idea it exists because it's written in highly complex medical legal language.
That is exactly why we published this breakdown at PennsylvaniaMarijuanaCards.com. The law officially lists it as damage to the nervous tissue of the central nervous system with objective neurological indication of intractable spasticity and other associated neuropathies. That is a massive mouthful. But in plain English, it means if you have chronic structural damage to your brain or spinal cord and standard muscle relaxers aren't cutting it, you likely qualify.
Because the legal name is so dense, patients search the web for their specific diagnosis rather than that exact phrase. What are some of the primary diagnosed conditions that actually fall right under this umbrella?
The list is extensive. It covers spinal cord injuries, traumatic brain injuries, spastic cerebral palsy, and post-stroke spasticity. It also covers rarer neurodegenerative disorders like primary lateral sclerosis and hereditary spastic paraplegia. Pennsylvania doesn't list stroke or cerebral palsy as individual categories, but survivors qualify perfectly under this central nervous system framework.
That clears up so much confusion. Now, let's address the phrase objective neurological indication. That sounds intimidating to a patient. Do they need to go get a brand new, expensive, specialized test just to prove their condition to us?
Not at all. It simply means the spasticity cannot be based on a verbal report alone. If you have an existing diagnosis from a stroke, brain injury, or spinal injury, that objective proof already lives in your medical history. Any past MRI imaging, an EMG study, or simple clinical exam notes from your treating physician documenting muscle tightness or hyperreflexation satisfies the state requirement completely. Our doctors just need to review those existing records.
Got it. So if they have the paperwork, they have the proof. Let's look at the science, because spasticity actually has one of the most robust clinical evidence bases in medical cannabis history, heavily anchored by international trials.
It really does. The clinical gold standard research is based on a standardized 1-to-1 THC to CBD spray. A major 2023 meta-analysis and a 2024 real-world study showed that balanced cannabis formulations act as an efficient add-on therapy, significantly reducing painful muscle spasms, improving sleep, and calming neurogenic bladder urgency for patients who failed conventional treatments.
And what about the phrase at the very end of the law? And other associated neuropathies. How does that protect patients whose primary issue might be nerve pain rather than stiff muscles?
That language is incredibly intentional. Central neuropathic pain, like severe burning sensations or hypersensitivity following a spinal cord injury or stroke, is notoriously treatment resistant. The law explicitly ensures that if your central nervous system damage causes agonizing nerve pain, you are fully covered under this condition, even if muscle stiffness isn't your primary complaint.
That is remarkably inclusive. Now, because many patients with spinal injuries, brain injuries, or strokes take complex medication regimens, let's talk safety and drug interactions.
This is a major clinical focus for us. Combining cannabis with standard prescription muscle relaxers like baclofen or nerve medications like gabapentin can cause additive central nervous system depression. This means a patient might experience heightened sedation or muscle weakness. It's completely manageable, but you must bring your current medication list to your consultation so our doctors can guide your dosing safely.
Absolutely. Safety first always. So if a patient or a loved one with chronic central nervous system damage wants to pursue their card through our telehealth practice, what does the process look like?
We've made it entirely seamless. Step 1 is filling out our quick 3-minute online form at PennsylvaniaMarijuanaCards.com. Step 2 is a relaxed telehealth consultation. You'll meet over video with a registered state physician, like Dr. Jonathan Chance Miller. His official NPI number and medical credentials are fully transparent and listed right on our site for absolute peace of mind.
And your practice maintains that same strict medical standard. If for any reason the doctor reviews their charts and finds that cannabis isn't a safe or qualifying fit, there's no penalty, right?
Exactly. If our medical team determines you do not qualify or that cannabis poses a safety risk to your current regimen, your $159 fee is fully and immediately refunded, no questions asked. If you are approved, Step 3 is automatic. We file your state certification that very same day. And if mobility or hand dexterity is an issue, our team will walk you through registering a caregiver who can legally pick up your products for you.
Completely risk-free, exceptionally thorough, and deeply compassionate. A vital resource for patients navigating severe neurological conditions.
Absolutely. If you are ready to find safe, medically guided relief for chronic spasticity or central nerve pain, visit PennsylvaniaMarijuanaCards.com, fill out the form at the top of our page, and let our medical team take care of you.
Book your telehealth consultation today at PennsylvaniaMarijuanaCards.com. Thank you for listening, and take care.